Every visual experience is different because every eye is unique. And with every eye, you have the potential to fashion a truly original masterpiece with the iDesign Refractive Studio. For over 100 years, measurements of the eye have been captured by subjective tools and rely on measurements of less precision. With the iDesign system's wavefront guided correction, treatments can be more objective, measure with greater precision, and capture lower and higher order aberrations, the small optical imperfections that are unique to each patient. The new iDesign system builds on our proven legacy in wavefront technology, delivering the first and only topo-integrated wavefront-guided procedure. This system enhances the current wavefront-guided treatment by integrating full and complete corneal topography into each and every treatment. Now you can capture lower and higher order aberrations inside the eye, as well as the corneal topography outside, creating a procedure that's incredibly personalized. The iDesign system begins each treatment by measuring the inside of the eye using wavefront analysis to quantify irregularities unique to each individual eye. To do this, the system projects a single spot of light onto the retina, capturing and analyzing the reflected light using over 1,200 sensors across the pupil, while simultaneously analyzing the outside, the corneal surface, using a highly advanced full-gradient corneal topographer. This maps the cornea by projecting a pattern of spots that measure the X and Y slopes at each point, instead of relying on a Placido disc topographer which only measures radial slope along its concentric rings. By capturing an iris registration image, the system is able to precisely align the two measurements on the eye. Both of these measurements, the wavefront analysis inside and corneal topography outside, will be fully integrated into the treatment plan. This plan is developed using the Fourier method, translating high-resolution data into an actionable ablation map. Before ablation, the system translates the wavefront measurements from the pupil to corneal surface, considering the minuscule variations of the cornea and its unique combination of steep, flat, and tilt. This process, known as wavefront vertexing, uses the captured topography data instead of K-values to create a treatment plan. This plan defines exactly how much corneal tissue should be removed from each specific spot. Next, the iDesign system considers how the excimer laser will interact with the cornea. To precisely perform the treatment on the cornea's curved surface, the laser must compensate for energy loss at specific points by applying greater energy to accurately ablate the peripheral areas. That's why the iDesign system uses the corneal topography instead of K-values to assign laser power and pulses at specific points. Only the iDesign system gives you the ability to understand every eye, inside and out, to create a solution as unique as your patient. It's this topo-integrated, wavefront-guided approach that makes the iDesign system an evolution in personalization, where you can create truly customized treatments for each patient. Because for them, it's about having the visual clarity they need to connect with every part of their lives. iDesign Refractive Studio, iDesign Advanced Wave Scan Studio System, and STAR S4 IR Excimer Laser System. Healthcare professional indications and important safety information. Indications. The STAR S4 IR Excimer Laser System and the iDesign Refractive Studio is indicated for wavefront-guided laser-assisted in situ keratomylusis (LASIK) to achieve monovision by the targeted retention of myopia, -1.25 to -2D in the non-dominant eye of presbyopic myopes, 40 years or older, who may benefit from increased spectacle independence across a range of distances with useful near vision, with myopic astigmatism up to -6D spherical equivalent as measured by iDesign Refractive Studio, with cylinder up to -3D, and a minimum preoperative myopia in the non-dominant eye at least as great as their targeted myopia, with an agreement between manifest refraction, adjusted for optical infinity, and iDesign Refractive Studio refraction as follows. Spherical equivalent, magnitude of the difference is less than 0.625D. Cylinder, magnitude of the difference is less than or equal to 0.5D. Cylinder axis. If either the manifest cylinder entered into the iDesign Refractive Studio or the iDesign Refractive Studio cylinder selected for treatment is less than 0.5D, there is no requirement for axis tolerance. When both cylinders have a magnitude of at least 0.5D, the axis tolerance is linearly reduced from 15 degrees, 0.5D, to 7.5 degrees, 7D or greater, based on the average magnitude of both cylinders. with documented evidence of a change in manifest refraction of no more than 0.5D in both cylinder and sphere components for at least 1 year prior to the date of preoperative examination, and with a successful preoperative trial of monovision or history of monovision experience. The STAR S4 IR excimer laser system and iDesign Advanced Wavescan Studio system, iDesign Refractive Studio, is indicated for wavefront-guided laser-assisted in-situ keratomelusis (LASIK) in patients with hyperopia and without astigmatism, as measured by iDesign Advanced Wavescan Studio system, iDesign Refractive Studio, up to plus 4D spherical equivalent with up to 2D cylinder, with mixed astigmatism as measured by iDesign Advanced Wavescan Studio system, Refractive Studio, where the magnitude of cylinder 1D to 5D is greater than the magnitude of sphere, and the cylinder and sphere have opposite signs, with myopia as measured by iDesign Advanced Wavescan Studio system, iDesign Refractive Studio, up to -11D spherical equivalent, with up to -5D cylinder, with agreement between manifest refraction, adjusted for optical infinity, and iDesign Advanced Wavescan Studio system, iDesign Refractive Studio refraction as follows. Spherical equivalent, magnitude of the difference is less than 0.625D. Cylinder, magnitude of the difference is less than or equal to 0.5D. 18 years of age or older, and with refractive stability, a change of less than or equal to 1D in sphere or cylinder for a minimum of 12 months prior to surgery. Contraindications. Laser refractive surgery is contraindicated in patients with collagen vascular, autoimmune or immunodeficiency diseases, in pregnant or nursing women, in patients with corneal abnormalities, including signs of keratoconus, abnormal corneal topography, epithelial basement membrane disease, EBMD, and degenerations of the structure of the cornea, in patients with symptoms of significant dry eyes. If the patients have severely dry eyes, LASIK may increase the dryness. This may or may not go away. Severe eye dryness may delay healing of the flap or interfere with the surface of the eye after surgery. It may result in poor vision after LASIK. In patients whose corneal thickness would cause anticipated treatment, would violate the posterior 250 microns of corneal stroma, in patients with advanced glaucoma, in patients with uncontrolled diabetes, in patients with documented evidence of a change in manifest refraction of more than plus 0.5D in both cylinder and sphere components for at least 1 year prior to the date of preoperative examination, in patients taking medications with ocular side effects. Examples are isotretinoin, Accutane for acne treatment, or amiodarone hydrochloride, Codarone, for normalizing heart rhythm. Warnings and precautions. LASIK is not recommended in patients who have systemic diseases likely to affect wound healing, such as autoimmune connective tissue disease, diabetes, or an immunocompromised status, have a history of herpes simplex or herpes zoster keratitis, have severe allergies or tendency to rub their eyes often, have glaucoma, elevated IOP, ocular hypertension, or being followed for possible glaucoma suspect, are taking the medication isotretinoin, Accutane, are taking antimetabolites for any medical conditions. To reduce the risk of corneal ectasia, the posterior 250 microns of corneal stroma should not be violated. Please refer to Operator's Manual for a list of additional precautions. Adverse events. Prior clinical study of monovision LASIK using the Wavescan Wavefront System Aberrometer supports the safety and effectiveness of iDesign-driven monovision LASIK treatment. Please refer to Operator's Manual for a list of adverse events and complications in clinical studies for monovision and presbyopic patients with low to moderate myopia and myopic astigmatism, myopia, mixed astigmatism, and hyperopia.